I am George Derrick, and today we will be doing something on urinalysis. And before we proceed to that, just kindly remember to hit the subscribe button. If you haven't subscribed, just remember to hit the subscribe button, and also you can hit the notification icon for you to stay updated when we update more content in future. So right away, let us see the composition of urine. So urine is majorly composed of water, which is about 95%. That is normal urine. I'm speaking of the composition of normal urine. We have water, urea, creatinine, uric acid, and electrolytes. But in the situation whereby we have abnormal urine, we will have glucose, proteins, bile pigments, blood cell, cast, parasites, bacteria, and microbes. All this will be in abnormal urine. So factors affecting the composition of urine include the diet and nutritional status, condition of the body metabolism, ability of the kidney to function, because the urine originates from the kidney after filtration of blood. The level of contamination with pathogenic microorganism also affects the composition of urine, whereby maybe you have a bacterial infection or even non-pathogenic microflora. There is what we call normal flora organism. So when we have this, it will affect, when they are in high amounts, it can affect the composition of urine. So right away, let us move to the collection and preservation of urine specimen. So how do we collect the urine specimen, and how do we preserve the urine specimen? So urine must be properly collected, whereby we use urine containers that are clean and dry. There are many types of containers used in collecting urine. We have disposable containers or plastic or coated paper, available in many sizes and are provided with lids to reduce bacteria and other types of contamination. I will briefly speak of the types of specimens that we collect for urine. So number one, we have the first morning specimen. This is a specimen obtained during the first urination of the day. So when you wake up in the morning, it's majorly good for nitrite and protein analysis and microscopic examination also. So we also have what we call the random specimen. This is a specimen obtained during any time of the day. Any time of the day you are sent to go and bring your urine sample, so we will call it the random specimen. It is the most convenient and the most common type of specimen that we obtain in the lab. It is good for chemical screening and also microscopic examination. So we have the third types of specimen called the second voided specimen. So in this case, the first morning specimen is discarded and the second specimen is collected and tested. So the first morning specimen, you discard it, then we go for the second specimen, which we collect and we test. Such type of specimen is majorly good for reflection of blood glucose and keeping of formed elements intact. So we have a fourth specimen called the postprandial specimen that is obtained 2 hours after taking a meal. It is good for glucose estimation. Then we have the fifth type of a specimen called the 24-hour specimen. This is a specimen obtained within 24 hours. This is a quantitative test, especially for quantitative determination of proteins. So we have the midstream specimen. This is a specimen obtained from the middle part of the first urine. So you urinate first, you stop, you obtain the sample, then you finish. So it will be called midstream urine specimen. It is commonly used for routine urinalysis. It is also important for bacteriological urine culture. So we have also the clean catch urine specimen. It is used for microbial culture and routine analysis. When specimens are collected for bacteriological examination, they should be collected with clean catch method or catheterization into sterile containers. So catheterization is the process of passing a tube through the urethra. You pass a tube through the urethra to the bladder for the withdrawal of urine. it may introduce urinary tract infection, and you should be careful with that. So the procedure for the collection of a 24-hour specimen: first of all, you inform or direct the patient to completely empty the bladder uh, and discard his urine exactly at the beginning of the 24-hour time of collection. So for example, let's say you want the urine to be collected from 6 a.m. Then you collect all the urine voided during the following 24 hours, including that voided exactly at the end of the 24-hour period. That is exactly at 6 a.m. the following day. That is the second day. So all the urine is collected and must be preserved. And if you remember, we said we use it for quantitative assays. The container should be labeled with the test ordered, the patient's name, the time of collection, and the preservatives that have been added. So speaking of preservatives, let us do something on preservation of urine specimen. So urine specimens should be examined immediately, as much as possible after it has been passed, because some urinary components are unstable. Long-standing urine at room temperature can cause growth of bacteria in the urine, breakdown of urea to ammonia by bacteria, leading to an increase in the pH of the urine, and this may cause precipitation of calcium and phosphates, oxidation of urobilinogen to urobilin, destruction of glucose by bacteria, and lysis of RBCs and WBCs and casts. All this might lyse if you leave it standing for too long. So the method of preserving urine: we have physical method, whereby we have refrigeration and freezing. We have the chemical methods. We use chemicals such as thymol, toluene, formaldehyde, hydrochloric acid, boric acid, chlorhexidine, sodium carbonate. All these chemicals can be used to preserve urine. So we have types of examination in urinalysis. We have the physical urine examination, whereby we observe the volume, color, odor, appearance, pH, and specific gravity. Then we have the chemical examination of urine. We have the glucose, protein, bilirubin, urobilirubin, blood, nitrate, leukocyte esterase, and the melanin. So we also have, other than examination of urine, physical and chemical, we also have microscopic examination of urine. We use the microscope to observe the urine, whereby we check for WBCs, RBCs, epithelial cell, casts, bacteria, yeast, parasites like the TV, Trichomonas vaginalis. It can be present in urine, crystals, artifacts. All these we observe in the microscope. So we have categories of urine tests. According to the degree of accuracy of the test, they are grouped into three broad categories. We have the screening tests. So the screening tests, they tell only whether a substance is present or absent, and the results are reported as positive or negative. That is a screening test. They only tell us whether this substance is present or not there, and we report the result as either positive or negative. The other one was qualitative test, whereby we determine the accuracy and the amount of substance present in the qualitative test. Then we have the quantitative test, are usually reported in milligrams per deciliter, grams per deciliter, and per liter. For quantitative tests, a complete 24-hour urine specimen is needed, like I said before. So physical examination of urine. I hope you are still together, and if you haven't subscribed, remember to hit that subscribe button at the bottom of this video. Just remember to support me. So let us go to the physical examination of urine. So urine volume, this is dependent normally on your fluid intake. If you take high amount of fluid, the urine volume will automatically be high. If you take low amount of fluids, your urine volume will be low. That I can just explain as that. So above normal amount of urine is called polyuria, that is due to large quantities of intake of liquids. Then we have under normal quantity of urine, we call it oligouria. That is urine less than 400 milliliters a day. Then we have anuria, urine volume less than 50 millimeters a day due to hot weather, sweating, low water intake, and maybe some diseases of the kidney and urinary tract. So the color of the urine. So urine color should be yellow to amber. That is a normal urine color should be yellow to amber. The color comes primarily from urobilin, of course, urobilin. So urobilin is the final waste product resulting into the breakdown of the heme from the hemoglobin during the destruction of the aging RBCs. So colorless or pale urine, dilute urine with low specific gravity and polyuria. We have also dark yellow and yellow brown urine. Concentrated urine is with a high specific gravity and small quantities. We have yellow brown or greenish yellow green form when urine is shaken by urobilinoids, chromagon delivered from the heme, biliverdin, and brown bilirubin and urobilirubin. So the appearance is just the transparency. How much can you see through the urine? Fresh voided urine specimen is normally clear and transparent. pH, a test that determines the acidity, neutrality, or alkalinity of a solution. So pH 7 indicates neutrality, less than 7 indicates acidity, and more than 7 indicates alkalinity. Normal and freshly voided urine pH ranges from 5 to 7 in healthy individuals and an average of 6. Specific gravity. So generally the specific gravity is defined as the ratio of the weight of a fixed volume of solution to that of the same volume of water at a specific temperature. I hope you got that specific gravity. Right, let us continue. Chemical analysis of urine. So we analyze urine chemically to determine maybe urine sugar. We have a dipstick chemical analysis whereby urine dipstick is a narrow plastic strip which has several squatters of different colors attached to it, such as glucose, bilirubin, ketones, specific gravity, blood, pH, protein, urobilirubin, nitrite, all those things they're attached to it. Then you dip the stick in a urine sample, and the specific parameters reacts to produce a color that is compared to the severity of the component that is present to it. The entire strip is dipped in urine sample, and color changes are sequentially observed compared to a chart that is predetermined. So we can also do microscopic analysis of urine. In microscopic analysis of urine, we view elements that are not visible without a microscope, such as the cells, such as red blood cells. And when red blood cells occur in urine, we call that hematuria. This can happen in glomerulus damage, tumors, urinary tract stones, upper and lower urinary tract infections. White blood cells or pyuria refers to the presence of abnormal numbers of leukocytes that may appear with infection in either the upper and the lower urinary tract infection. Epithelial cells are common in urine also. Renal tubular epithelial cells are common. We also have casts. Urinary casts are cylindrical structures produced by the kidney and present in the urine in certain disease states. They are formed in distal convoluted tubule and collecting ducts of the nephron. The they dislodge and pass into the urine, where they can be detected by microscopy. Urine casts can be made up of cells such as white blood cells, red blood cells, and kidney cells, or substrates such as protein. The factors which favor protein cast is a low rate of filtrate, high salt concentration, and low pH.